Because the human body cannot store oxygen, it must continually supply tissues and cells with oxygen through the combined actions of the respiratory and circulatory systems. The respiratory system includes the lungs and the airway, the passage from the mouth and nose to the lungs. Expansion of the chest during breathing causes suction, which pulls outside air containing oxygen through the airway and into the lungs. Relaxation of the chest increases the pressure within and forces air to be exhaled from the lungs. The circulatory system includes the heart and a body-wide network of blood vessels. Electrical impulses stimulate mechanical contractions of the heart to create pressure that pushes blood throughout the body. Blood vessels in the lungs absorb oxygen from inhaled air. The oxygen-rich blood goes to the heart, then out to the rest of the body. Large vessels called arteries carry oxygenated blood away from the heart. Arteries branch down into very small vessels that allow oxygen to be absorbed directly into body cells so it can be used for energy production. Veins return oxygen-poor blood back to the heart and lungs, where the cycle repeats.
So, Jamie, did our forecast come through according to our early projections?
Yeah, it did. We're a little tight with our budget, in some certain areas, so we're going to have to work on that. How's it coming?
Oh, it's going pretty good here.
So it looks like we can follow through with that marketing plan. Have you talked to Ron over at Star Graphics yet?
No, not yet. But I will do it today.
Dale? Dale? Are you okay?
What is it?
I don't know.
Sudden cardiac arrest, or SCA, can occur without warning to anyone at any time. It is one of the leading causes of death among adults in the United States. Sudden cardiac arrest happens when the normal electrical impulses in the heart unexpectedly become disorganized. The normally coordinated mechanical contraction of the heart muscle is lost, and a chaotic, quivering condition known as ventricular fibrillation can occur. Blood flow to the brain and body abruptly stops. The lack of blood and oxygen to the brain causes the person to quickly lose consciousness, collapse, and stop breathing. Brain tissue is especially sensitive to a lack of oxygen. When oxygen is cut off, brain death can occur quickly, within a matter of minutes. Without early recognition and care from a bystander, the person will not survive. Cardiopulmonary resuscitation, or CPR, allows a bystander to restore some oxygen to the brain through a combination of chest compressions and rescue breaths. By itself, CPR is only a temporary measure that can buy time until more advanced care can be provided. The most effective treatment for ventricular fibrillation is defibrillation. To defibrillate, electrode pads are applied to the chest and an electrical shock is sent between the pads through the heart. This shock stops ventricular fibrillation, so the heart's normal electrical activity can return and restore blood flow. Successful defibrillation is often dependent on how quickly a person is defibrillated. For each minute a person is in cardiac arrest, his chance of surviving decreases by about 10%. After as little as 10 minutes, defibrillation is rarely successful. The amount of time it takes to recognize a problem, activate EMS, and have EMS respond and defibrillate is usually longer than 10 minutes. In most cases, it's too late. An automated external defibrillator, or AED, is a small, portable, computerized device that is simple for a minimally trained bystander like you to operate. Turning on an AED is as simple as opening a lid or pushing a power button.
Remove clothes from patient's chest.
Once it is on, an AED will provide voice instructions to guide you through its use. An AED automatically analyzes the heart rhythm, determines if a shock is needed, and charges itself to be ready to defibrillate. An operator simply pushes a button to deliver the shock when told to by the AED. In many cases of sudden cardiac arrest, if defibrillation can be delivered sooner before EMS arrives, more people would survive.
Immediate high-quality CPR and defibrillation with an AED from a bystander can double or even triple the chance for survival.
Go get Alberta.
Alberta, there's something wrong with Dale.
A trained provider is someone trained in the delivery of CPR and use of an AED until personnel are available to provide more advanced care. The essential responsibilities of a trained provider are recognizing cardiac arrest, making the decision to help, identifying hazards and ensuring personal safety, activating the EMS system, and providing supportive basic life support care. The goal of this training is to help you gain the knowledge, skills, and confidence necessary to manage a medical emergency until more advanced help is available. Performing CPR and using an AED does not require making complex decisions or having in-depth medical knowledge. It is easy to learn, remember, and perform.
Dale, it's Alberta. I'm trained to help. Are you okay? Are you okay?
Some people fear being sued as a result of providing care in an emergency. Understanding more about the legalities can help reduce this fear. All states have passed what are known as Good Samaritan laws to help encourage bystanders to assist those in need.
These laws help protect anyone who voluntarily provides assistance without expecting or accepting compensation, is reasonable and prudent, does not provide care beyond the training received, and is not grossly negligent or completely careless in delivering emergency care. Good Samaritan laws vary slightly from state to state. Become familiar with the laws in your state and other states where you work or travel. Everyone has the right to refuse medical treatment. It is appropriate to ask a responsive person if they want help before providing care. When a person is unresponsive, the legal concept of implied consent allows a provider to help without asking, because it assumes the person would agree to be helped if responsive. Once care has begun, and it is safe to do so, remain with the person until someone with equal or greater emergency medical training takes over. If alone, it is okay to leave to activate EMS, but return to the person as soon as you can. There has never been a successful lawsuit in the United States against a person providing CPR. Still, it is appropriate to use common sense. Activate EMS immediately. If the scene is unsafe, do not enter. Never attempt skills that exceed your training. And once you have started, don't stop until someone with equal or greater training relieves you. A general impression is a quick sense of what has occurred or is occurring when you first observe an emergency scene. Does the person appear to be unconscious? A person who appears to have collapsed could have experienced a sudden cardiac arrest. Your immediate assessment and care can be his only chance for survival.
The most critical decision you will make is whether to get involved when a medical emergency has occurred. It is normal to feel hesitant because you are unsure of your ability to help. You might hesitate because you feel like you are alone in helping. You are only the first link in a progressive chain of emergency care. Your involvement lasts only until relieved by another trained provider or responding EMS providers, in most cases, a very short period of time. You might hesitate for fear of making things worse. Your training provides you with sound knowledge and skills designed only to help and not harm those in need. You might also hesitate because you think you don't have a lot of medical knowledge. Extensive medical knowledge is not necessary. CPR skills are based on common sense and simple, effective procedures that can be easily learned and safely applied. Finally, you might hesitate because others have already stopped to help. It never hurts to see if additional assistance is needed. Other bystanders may not have any training or may be hesitant to provide care.
Emergency scenes are often unsafe. Your personal safety is always the highest priority, even before the safety of the person who needs help. Putting yourself in danger to aid someone can make the situation worse.
Always pause for a moment before approaching an emergency and look for obvious hazards. Consider the possibility of hidden dangers. If the scene is unsafe, do not approach. If the location you are already in becomes unsafe, get out.
Mark, call EMS and get the AED.
Okay.
When caring for someone, you can be exposed to blood or other potentially infectious body fluids. While the risk of contracting a disease is extremely low, it is prudent to take simple measures to avoid exposure in the first place. Infectious bloodborne diseases include hepatitis B, hepatitis C, and HIV, the virus that causes AIDS. Exposure can occur through the direct contact of infectious material with an open wound or sore, or through the mucous membranes of the mouth, nose, and eyes. Exposure can also occur through a skin puncture with a contaminated, sharp object. Reducing exposure lowers the chance of infection. Universal Precautions is an approach that recommends handling all blood and other body substances as if they are infectious. Use protective barriers between yourself and an ill or injured person. To be effective, the approach is the same for everyone, regardless of relationship or age. Disposable gloves are the most commonly used barrier. Make sure there is always a fresh supply of gloves in your first aid kit. Inspect gloves for damage or tears when you put them on. If damaged, replace them immediately.
Always remove contaminated gloves carefully without snapping.
Without touching bare skin, pinch the glove at either palm with the fingers of the opposite hand.
Gently pull the glove away from the palm and toward the fingers, turning the glove inside out. Gather the glove you just removed with your gloved hand.
Carefully slide your bare index finger inside the wristband of the gloved hand. Gently pull outwards and down, inverting the glove and trapping the first glove inside. Throw away gloves in an appropriate container to prevent any further contact. Even after using gloves, use soap and water to clean your hands and any exposed skin. Use an alcohol-based hand sanitizer if soap and water are not available. If a person requires rescue breaths, use a shield or CPR mask with a one-way valve to minimize direct mouth-to-mouth contact. A provider may elect to not use barriers, depending on her relationship to the person and knowledge of the person's health status. Emergency Medical Services, or EMS, describes the emergency medical response system developed within your community. An EMS system typically uses a specialized emergency communication network to gather information and dispatch appropriate emergency resources. EMS providers within the system respond directly to emergency scenes, provide emergency medical care, and transport ill or injured people to a hospital. One of your fundamental responsibilities as a trained provider is to activate the EMS system in an emergency. Immediate EMS activation is recommended when a person is unresponsive or the severity of a person's condition is unclear. Activating EMS usually consists of calling an easy-to-remember universal emergency telephone number, such as 911. Ideally, one person should call EMS while another person cares for the ill or injured person. An EMS dispatcher with specialized training will answer the call. The dispatcher will ask for basic information, such as the type of emergency, location, the number and conditions of those who are ill or injured, and what care is being provided. Answer the dispatcher's questions as clearly as you can. Only hang up if directed to do so by the dispatcher. You may have an emergency action plan in your workplace that contains specific procedures on how to respond to internal emergencies and activate EMS. It is important to become familiar with the emergency plan where you work. The majority of medical emergencies occur at home, so it is also smart to develop a personal emergency response plan for your home and review it frequently with members of your household. The primary assessment helps you assess for immediate life-threatening problems, activate the EMS system, and rapidly provide priority care. It is the same for all ages and is performed quickly. Before anything else, pause and assess the scene for hazards. If the situation is dangerous to you, do not approach. If it is safe to do so, approach the person. If he appears unresponsive, tap or squeeze the shoulder and ask loudly, "Are you okay?" Use the person's name if you know it. For an infant, tap the foot.
If the person is unresponsive, have another bystander activate EMS and get an AED if one is available. If you are alone with an unresponsive adult, immediately alert EMS and get an AED yourself. Quickly return to the person. When alone with an unresponsive child or infant, provide about 2 minutes of CPR before leaving to call for EMS and get an AED. Look at the face and chest for normal breathing. Do this quickly. Normal breathing is effortless, quiet, and regular. If normal breathing is found, place the person on his side in the recovery position. Weak, irregular gasping, snorting, or gurgling sounds can occur early in cardiac arrest. These actions provide no usable oxygen. This is not normal breathing. If someone is not breathing or only gasping, perform CPR.
I need some help in here! Help! Yeah, he was acting kind of funny when I came in, and then I thought he was going to fall down, and so I had him sit down, and then he just passed out.
Let me get in there. I'm trained to help.
Okay.
Steve?
Even if a person is breathing normally, a lack of responsiveness is still considered to be a life-threatening condition that requires immediate care.
Call EMS and get the AED.
Okay, sure.
There are a variety of things that can result in unresponsiveness, including medical conditions such as stroke or seizures, or external factors such as alcohol or drug overdose. Regardless of the cause, the greatest treatment concern is the ability of the person to maintain a clear and open airway. Positioning an uninjured, unresponsive person in the recovery position can help maintain and protect the airway. This position uses gravity to drain fluids from the mouth and keep the tongue from blocking the airway. Anytime you have the impression someone is unconscious, act quickly. If it is safe for you to approach the person, do so. Tap or squeeze the shoulder and ask loudly, "Are you all right?" If the person is unresponsive, have a bystander activate EMS and get an AED. Look at the face and chest for normal breathing. This person is breathing normally. Placing her in the recovery position will protect her airway. Begin by placing the arm nearest you up alongside the head. Bring the far arm across the chest and place the back of the hand against the cheek. Grasp the far leg just above the knee and pull it up so the foot is flat on the ground. Grasping the shoulder and hip, roll the person toward you in a single motion, keeping the head, shoulders, and torso from twisting. Make sure the head ends up resting on the extended arm and the head, neck, and torso are in line. Roll far enough for the face to be angled forward. Position the elbow and knee to help stabilize the head and body. Make sure there is no pressure on the chest that might restrict breathing. If an unresponsive person has been seriously injured, do not move him unless you are alone and need to leave to get help. Frequently assess the breathing of anyone placed in a recovery position. The condition can quickly become worse and require additional care.
Yes, he is breathing. Someone's with him.
AEDs are designed to be simple to operate. Voice, lights, and screen instructions guide an operator in using the device. There are many different brands of AEDs, but the same basic steps for operation apply to all of them. Turn on the AED. This starts voice instructions and readies the device for use. Opening the lid will turn on the power with some AEDs. With others, a power button is pressed. Adhere the defibrillation pads to the person's bare chest. Pads are placed in specific locations to direct the electrical shock through the heart. Most pads are pre-connected to the device, but some AEDs require you to plug in a connector. Allow the AED to analyze the heart rhythm. An AED automatically starts analyzing once the pads are in place. If defibrillation is required, the AED will charge to get ready for shock delivery. Safely deliver a shock if directed to by the AED. Keeping others clear, a button is pressed on most AEDs to deliver a shock. Immediately after a shock is delivered, CPR is resumed, starting with chest compressions. Voice instructions and additional analysis by the AED will guide providers through further care. AEDs are designed to detect problems during use and guide you through corrective actions. If a troubleshooting message occurs, stay calm and follow the AED's voice instructions. If the AED indicates a problem with the pads are not completely adhered to the skin, or there is a poor connection to the AED. Press pads firmly, especially in the center, to make sure they are adhering well. Make sure the pad's cable connector is firmly connected to the AED. If the chest is wet, remove pads and wipe the chest dry. Apply a new set of pads. If pads do not stick due to chest hair, pull the pads off and quickly shave the hair. Attach another set of pads. Another troubleshooting message may indicate that analysis has been interrupted due to movement. Stop all sources of movement, such as chest compressions or rescue breaths. If a message indicates the need to replace a battery, there may only be enough energy for a limited number of shocks. If the AED fails to operate, the depleted battery should be removed and replaced with a new one. A person should be removed from standing water before using an AED. It is okay to use an AED when a person is lying on a wet surface, such as in the rain or near a swimming pool. An AED should never be immersed in water or have fluids spilled on it. AEDs can also be used safely on metal surfaces, such as gratings or stairwells. Make sure pads do not directly touch any metal surface. Someone may have a surgically implanted device in the chest, such as a pacemaker or an automated internal defibrillator. A noticeable lump and surgical scar will be visible. If the implanted device is in the way of correct pad placement, place the pads so the edges are at least 1 inch away from the device. Defibrillating over medication patches could reduce the effectiveness of the shock. If a medication patch is interfering with placement, use a gloved hand to peel off the patch and wipe away any remaining residue before placing pads. Caring for someone in an emergency can create emotional distress. More serious problems or relationships with those involved can intensify these feelings. Common reactions include anxiety, trembling or shaking, sweating, nausea, fast breathing, and pounding heartbeat. This is a normal human reaction to a traumatic event. Simply remember to stay calm and accept your limitations as a provider. When an emergency is over, a provider is often left alone while an ill or injured person is transported away by EMS. With little time for closure, you can begin to experience a variety of reactions. These include feeling abandoned or helpless, recalling the event over and over, self-doubt about not doing enough, difficulty concentrating, heaviness in the chest, upset stomach or diarrhea, and difficulty sleeping or nightmares. It is important to understand that these feelings are normal and should pass with time. However, there are actions you can take to help cope with and work through the difficulty. Informally speak to someone you trust to listen without judgment, such as a family member, friend, or coworker. Get back to a normal routine as soon as possible. Accept that it will take time to resolve these emotions. If unpleasant feelings persist, formal assistance from a professional counselor may be helpful as you work through your emotions surrounding the event.